There are several good tips we'd like to share now regarding your total knee replacement and things to consider after you get home. The first sentence here, bending or flexing and straightening or extending the knee, is very important during the early stages of your rehab. The exercises that you have been instructed in doing in this presentation are very important, and a lot of bending and a lot of extending of the knee is done with those exercises. Knees basically do that. They straighten and they bend. They do not like twisting. So we encourage you to avoid twisting in your knee because it can be quite uncomfortable. And so when you are walking with your walker in the first number of days, again, avoid turning on a dime because you will probably twist the knee if you had such a tight turn. Make nice sweeping big turns. Keeping the knee straight in bed when you're in bed and elevating it is important. The knee's capacity to become fully straight, it's very important that you develop that capacity to straighten the knee as soon as you're able. The better you can straighten your knee, the faster you can straighten your knee, the quicker your rehabilitation process goes. Bending and straightening the knee several times before standing will help with the stiffness that you are likely to feel. So if you just pump the knee, just gently several times before you stand, it'll feel a little looser when you then go to stand. And after you get home from the hospital, really we encourage you to get up frequently. If you're watching a television show during the commercial break, consider pumping your legs several times, your knees several times. Go to stand, walk across the living room, and sit back down. If you have company come over, tell them you are going to be getting up every 20 minutes and just walking around a little bit. Because if it's the case that you get into conversation with company who comes over, or you watch a movie for a couple hours and then go to stand, you'll feel much stiffer. And we want to avoid that as much as possible. And swelling is pretty normal in the knee and even in the lower part of the leg and foot. And so elevating the leg and using your ice machine will be of big importance in keeping the swelling under control.